Have you ever been sick? A cold? A flu? Of course you have. Sometimes it gets so bad you just need a doctor's help or input. We here at AJT Association are here to tell you about those antibiotics you get prescribed over and over again by your doctors.
Doctors get thousands of patients every year coming to hospitals and clinics needing a checkup. Most of those patients just have the common cold or flu and can only be treated with lots of water, rest, and non-prescription medicines. But the patients want solutions. They don't want some doctor telling them what they already know. The people want a proactive response. Doctors prescribe antibiotics.
We're here to tell you about antibiotic resistance. We need to stop using antibiotics, and this is why. Antibiotic resistance is a consequence of evolution with natural selection. Taking antibiotic action is of pure society pressure. The bacteria which have the mutation that allows them to survive through the working antibiotic reproduce and pass their surviving trait to their offspring. Then it will be a fully resistant generation.
This is all a subject of natural selection. The bacteria that makes you sick has been evolved to be resistant to antibiotics through the overuse of antibiotics, which is a major concern. The effectiveness of antibiotics have been greatly reduced and almost don't work at all depending on what it treats. Now here are some key facts you need to know. Number 1, antibiotic resistance caused by bacterial evolution is one of the biggest threats to global health and development today. Fact number 2, antibiotic resistance can affect anyone of any age in any country. The bacterial evolution is everywhere, not just in one spot. Fact number 3, resistance occurs naturally, but the misuse of antibiotics is accelerating the process greatly. Fact number 4, a growing number of infections such as pneumonia, tuberculosis, and gonorrhea are becoming harder to treat as the antibiotics used to treat them become less effective.
Antibiotic resistance also leads to longer hospital stays, higher medical costs, and increased mortality. National strategy takes many things into account, including opportunities to combat the threats. These opportunities include detecting and responding to antibiotic resistance requires the approach to data collection, recognizing that the health of the people is connected to the health and animals of the environment. Implementing evidence-based infection control practices can prevent the spread of resistance. Encouraging development of more therapies and drugs to treat infections. Identifying new innovations and technologies to develop next-gen tools. Recognizing that the antibiotic resistance is a global health problem that requires international attention and collaboration.
When antibiotics don't work, result can be longer illnesses, more complicated illnesses, more doctor visits, more deaths caused by BSC enterical infections. Using antibiotics against infections will not cure the infection, will not keep others from catching the virus, will not make a person feel better.
May cause unnecessary, harmful side effects and contributes to antibiotic-resistant bacteria. Here's what you should know about what the FDA is doing to combat this problem. These activities include approval of certain new antibiotics, labeling regulations addressing proper use of antibiotics, partnering to promote public awareness, encouraging THR development of new antibiotics. They are doing all
of this to combat resistance and be able to use antibiotics. Bacteria haven't evolved to resist yet. Here are some tips for you to help combat antibiotic resistance. Wash your hands. Often do what your doctor says when you're prescribed antibiotics. Cook and handle meat properly. Take care when visiting family and friends in the hospital. Think twice before requesting antibiotics for a cough or cold. Stay up to date with vaccinations.
Thanks for watching. We here at the AJT community hope you take our advice. Yeah! I didn't
You should leave in the noise of you doing